Alaikum and hello everyone. I am Dr. Muhammad Fawad Khan. Today we will be discussing how to take the history of an epileptic attack. We know that in emergency departments we regularly see patients that present to us with fits. First of all, we have to confirm the diagnosis that whether it is a true fit or not, and it can be easily done with the help of the history. And Secondly, then we have to classify its type and then the probable treatment. Uh, Eventually, after this, then we will have to do EEG and these other tests. But the history is very important in the case of any epileptic fit. So let's begin. Features of a suspected seizure event, which we will be discussing now. Actually, there are main three stages of an epileptic attack. One is the before the event, one is the during the event, and one is after the event. So these are the main three phases. One is called pre-ictal, then ictal, and then post-ictal. So pre-ictal or prodrome or aura. First of all, you have to ask the patient if he is conscious, or if he is not conscious, then you can ask his relatives that whether. First of all, you should know that whether it was a first attack or there are some attacks before it, and then you should ask that what factors cause these attacks. If he has a series of attacks, then there should be some precipitating or provoking factors, like some has exposure to the bright lights or during watching some noisy TV, and there can be some other factors. Second question you should ask that what are the preceding symptoms, like some patients have auras, like they feel some gustatory or olfactory symptoms, so you should ask about that, and then the duration of symptoms. Before the event, you should ask about the any precipitating or provoking factors, the preceding symptoms, and duration of symptoms. Then we have a main event that is called ictal stage. Uh, there are six main questions that you should ask. Uh, Motor symptoms, whether there was jerking of the whole body or a specific part of the body. Second is sensory symptoms, any paresthesias or some have some special sensation like gustatory, olfactory. So these can be also this it can be also an epileptic attack. Third one is that during the attack, level of awareness and responsiveness. Like in most cases, during an epileptic attack, the awareness is actually impaired. Like the patient is not understanding and not responsive. The fourth one is tongue bite. We always ask that whether he has any tongue bite or tongue injury during the epileptic attack, and you by self can see the tongue for any injuries. The fifth one is the urinary incontinence. Many patients have urinary incontinence during the attack, and last one is the duration of event. A typical epileptic fit can be motor symptoms or sensory symptoms, but in most like we have tonic-clonic fits of the whole body, uh, and there is tongue biting and urinary incontinence, and it is about 2 to 3 minutes or maybe less than that. It is the ictal phase. Then after the event, and which is also called post-ictal stage. For many patients after the event, they are drowsy, they are very less responsive, and many mimics of the epileptic fit like syncope, etc. Patient is very responsive. So it is also one thing that with the help of which you can differentiate level of alertness, confusion, and again duration of symptoms. A patient present to you in ER, he is all right, but he is now all right, but he is saying that I have this epileptic fit about 1 hour ago. So you have to ask that whether it is your first attack or there are many attacks before it, precipitating or provoking factors, preceding symptoms, and duration of symptoms. Then you should ask that during this attack whether there were motor symptoms or sensory symptoms, urinary incontinence, tongue biting, level of awareness, and the duration of symptoms. And then after the attack, aware level of awareness if there was any confusion and duration of symptom. So this is the history. If there are many positive points, so you can strongly say that it is an epileptic attack. And also, if the patient is saying that I have multiple epileptic attacks, so then you have to ask about the pattern of events, like how much time it occurs in a week or month. So you should ask about frequency and duration, and also that whether it is all the same type or it is different at different type. Like in many cases the patient has actually one type of seizure, like tonic clonic or absence, and like the mimics of the seizures may be not stereotypical or just in one fashion. So it is also very important that you can differentiate between the two things. So it is a pattern of events. This is a patient history. First of all, you have to ask the medical history. Like there are many medical conditions which can cause the fits, like hypoparathyroidism, hypocalcemia. Maybe patient have some history of neoplasm in the CNS neoplasm. So these all can give you a clue that it can be the cause of seizures. Second one is the family history. Like you can see that there are some typical syndromes that is genetically transmitted. So also the patient can have a positive family history. And third one is very important, the drug history. After taking the CNS stimulants you can have a fit, so you have to ask about the drug history. Also other like you asked about the medical history, the family history, and the drug history. Other important four questions is that birth history. The birth was normal or not normal, it was a vaginal delivery or C-section, and there is during any injury during the birth. Childhood febrile convulsions, it is also very important. Severe head trauma or other neurological insult, and psychiatric illness. So these are very important questions you should ask in the medical history. What should you ask in the drug history? For example, if a patient is already taking some medications, so there are certain drugs which can cause person a fit, mostly in those cases, in those patients which are susceptible to the fits. Over the counter medication, illicit drugs, and alcohol use. So these are very important questions. Family history, as we discuss. So now there is a case scenario. Mr. John, 30 years old, present to ER department. He was confused and his friends told doctors on duty that while during partying he has sudden jerking of the body and fell to the ground and hurt his left arm. You are on call, neurologist. How will you proceed? And with history of suspected epileptic fit. So this is task for you people at your home, that how you should proceed with the history, because in most cases with experience, if you take this typical type of history from every patient that present with epileptic fit, so with experience you will then easily differentiate whether it is an epileptic fit or non-epileptic fit. And for confirmation of epileptic fit, you can then send the patient for further investigation like EEG and MRI brain. So that was a short introduction that how to take a history of an epileptic fit. I hope I'm very hopeful that it will be very useful video, and thank you very much for your time.